and challenges for present age adolescents and youth and future human capital in Pakistan. We aim to discuss that opportunities and challenges faced by children, adolescents, and youth in Pakistan, and how the potential of more than 60% of adolescent and youth population can be harnessed to contribute to the future human capital development. Uh, with this brief introduction, let me introduce, we have with us Dr. Jasim Anwar. Dr. Jasim is a sector specialist of health at the Ministry of Planning, Development and Special Initiatives. We have with us Dr. Saima Nazir Khan. She's the Deputy Director, Research and Policy. She's the Director, uh, Research and Policy at Ministry of Climate Change and Environmental Coordination. We are also expected to be joined by Mr. Ikhlaq Ahmed, who is the Associate Professor at Department of Sociology in University of Punjab, Lahore. And last but not the least, Dr. Mehreen Mujtaba, who's the Director of Climate and Health and Nutrition at Ministry of National Health Services Regulation and Coordination. Let me also introduce Dr. Razia Safdar, who's the Senior Advisor at Center for Health Policy and Innovation at STPI. And let me request her for her opening remarks and an overview through her presentation also.
Thank you for Wasif. Thank you very much for joining us. We have with us the esteemed panelists, and also we have our colleague from Ms. Mehreen Jamal from UNICEF, and she has joined, and two of the panelists are late, and they will be joining soon. And this discussion, actually, this is about report. We had a session on this topic in our Sustainable Development Conference, which is an annual conference, and that was hugely appreciated, as well as there were some the head of the UNICEF was with us, and they made some good contributions, and they were very crisp policy recommendations from his side and the other esteemed panelists, and we have developed a report on this, and we are just going to disseminate this report today, as well as today's panelists about government policies, and that will also be incorporated in the report for the policy recommendations. So I think just to overview what we gained from that conference and from that and what is in the report, and then we will go for the discussion. That is a short presentation, and I will just explain some issues which we discussed. Actually, I'm presenting it because this was a very multidimensional discussion, focusing on many sectors which are related to the adolescent and the children. So that's why we are presenting this. You can thumbs up, please. So the objective, this is the objectives of that conference. That was to catalyze the national and regional dialogue on the pivotal role of the adolescents and the youth. And then so that we can come up with some comprehensive policies that addresses the education, health, climate resilience, digital inclusion, and the persons with disabilities in that of children and youth centered. This was all youth-centered policies. And then we foster the cross-sectoral partnership between the government, international organizations, private sector, and civil society. And then we wanted to identify how to leverage Pakistan's demographic youth dividend while addressing the social and environmental challenges. And so that was all effort was towards the sustainable development outcomes by 2047. Next, please. Next, Hamza. Next slide. Okay. Okay, you have already there. Okay. So this was this was a conceptual framework which we made on that on one side, we have the population, which is projected to be around 400 million in 2047, which can be inhibitor as well as the promoter of the human capital development. And the other side is the adolescent and the youth, which is the dividend, and that is about the median age at the moment is 20 years, 20 years, which is quite a productive age. And then the areas and the sectors which we need to focus on is health, wash, nutrition, social protection, education and green skills, and then the gender, with the gender and equity as a cross-cutting sectors. So, but what we found was that the climate change and the population both can be, as I know, because the policies which are focusing on this population cannot work on the 2047 population, as well as the population, as Dr. Vasif has told, that there is a more than 60% of the youth bulge. So how do we deal with this youth bulge, which can be and on the other side, if we make the climate resilience policies or the climate resilience resilient interventions that can be promoters, and otherwise, and very important that the climate is like we are fifth the most vulnerable country of the world, and we have faced the big floods in 2022, as well as there is a series of floods which Pakistan is facing, and then we digital inclusion, which is the digital skills, or the future era is projected as a digital era, as the AI, IoT, or the blockchain economies and all these things. So we will discuss about these things in that conference, and then I want to next slide, please. So this is the many people must be knowing this is the demographics of Pakistan. Right on the left side is today you can see that up to 30 years of age it is 4.2%, and up to 60%, almost 60% is on the up to age of 29 years. And if we see this is the projected pyramid of 2047, then we can see that the base is reduced, and youth and the 30 to 34 years is the people more than 30 years is more than they projected on the which are now. So this youth bulge will be after 22 years, will be in these ages. So how we can make them more productive and more aware of the futuristic, more productive, and how can we capitalize their dividend? Next, please. So just an overview of demographics. So Pakistan's rapid population growth, the total population is 241 million now, and with the annual growth rate of 2.5%, and that is significantly above the regional level, which is 1.2%, and even it is more than Afghanistan. Median age is 20.4 years, and even in Balochistan it is 14.1, very young age, and projected to reach the approximately 360 million by the certain website, but in the World Bank reports and others it is about 400 million. It will be reaching to the 400 million, and then 2/3 of the population of Pakistan is under the 30, and 35% is under 16 years of age. And that youth bulge a capital and active contribution towards economic growth on one hand, but burden on the existing infrastructure and financial resources that can result into growing disparity in labor market and job opportunities. And there is a disparity in, if not capitalized, this can result in disaster as well. So next slide, please. Next, okay. So social sectoral situation is like, for example, Pakistan is 161 first in the Human Development Index. Stunting is static from 1963, that is 40%. Their inadequate health financing, that is 1% of the GDP, which should be increased, and mostly it is allocated towards the tertiary care, and there is no significant allocation for the adolescent specific. And then early child development, and the second is the main focus where the nutritional interventions can act. So it is very important to do the interventions at that time. But there is a second window of adolescent which can where the nutritional intervention can result into the reduced stunting. And health system resilience is, as we have seen, that that the climate change and other disasters we need to have a health system, resilient health system. And education, there is a 61% literacy rate, and 33% of the young population are neither educated, employed, or the trained. For example, the female is higher, 54%, of 15 to 24 years are not employed or trained or educated. And then the 26 million children are out of school, which is quite a number, and 58% are the girls. And then the gender gap is in education in Punjab is 15%, and the Punjab is considered as the highest, our province, which is the most developed. And what is the condition in the other provinces is different. Next slide, please. So we discussed about the climate resilience and digital skills as well. So there is a need for the disaster risk reduction, and the NDRMF's chief the CEO was there, and he highlighted that there is a lot of investment in that, and adolescent needs to have the institutional arrangements, and but there is as we say that the current generation or the generations before, they have not kept the capital invested on the future human capital. So this is the time to do that. And there is a shrinkage of the job market as well because of the burden, and and hinders the startups. That is, on one side, it is enabling the startups to do their own self-employment towards the employment, and there is a vertical incubation centers which are mostly in women-led centers, which are training these adolescents on the climate resilience as well as digital inclusion. Different courses, about 4 million people has been trained from the Ignite or the other institutions in Pakistan. And there is a lack of tech infrastructure particularly in the rural areas. In the water sector, we have multiple deprivation aspect of emergencies, because in the emergencies we are not only dealing with one sector, but we are dealing with the other sector, like for example the nutrition, the shelter, the food security, as well as the wash, which is particularly important for the women. For example, the menstrual health management, as well health management, as well as it leads to the lack of wash areas. It leads to the diarrheal diseases, which results in the high mortality in the children, as well as it affects, and it results into the later on, which certain conditions which results due to the bad water, results into the gut disease, which results into the malnutrition. And still we have the polio, and I think the third polio case is being noted in Pakistan recently. And during the emergencies, there is increase vulnerability of the women towards the violence, and there is a gender equality, and there is a matter of gender equality, and the green jobs are required. Next is. Then comes the social protection. Social protection, we discussed on it came out from the discussion that only 5% of the formal economy is covered by the social protection. And the informal economy, informal workers are about more than 70%. So there is no particular social mechanism, social protection mechanism. And in social protection mechanisms are just temporary income transfer mechanism for low wage persons. And there is a decline in the social market economy, and there is effectiveness of the EOBI and Workers' Welfare Fund is declining as well. And there is disability inclusion is there is a problem with the disability inclusion because there is outdated certification and the rise in the man-made disability is there. And there is a limited access to social protection programs, and there is a disparity in the national and the provincial programs. Like BISP is covering, not covering disabled person in the center, but the Punjab government is covering. And there is a youth participation is also not very conscious of the status, social status, but they are not participating towards the increasing it. And there is climate anxiety, stress, and there is due to the, in the particularly in adolescent at school level, the people, the schools who are being affected by these climate events like floods, there were displacements as well as these children were not very like they were not they were anxious about the future of their schools. And then I have the future is obviously the technology and AI and all. So where we are standing is we are not. It's not no. It's multipolar world. So every country is being affected, and every country will have their own disasters. And so we came up with some few consensus points for the policy recommendations, which I'm going to. Next slide, please. So, in social and cultural capital, that was fostering an ideology of justice and equality, and that is the foundation for the inclusive and sustainable policies. And then enhancing the youth mindset for the economic development, making them aware that the economic development is has to be in front, and prioritizing the social market economy, that is the balanced market mechanism with the social welfare programs which are required for this poor country. Next, please. Inclusivity is the recommendations were from reduce the 15% gender gap in education by addressing the issue of out of school girls, which is a big issue, and then substantial investment in the women's education, vocational training, and employment opportunities should be inclusive of the persons with disabilities. And then mental health resilience for adolescents is very important for their future development. And social protection, and the next slide, please. So there was a recommendation that there is a recommendation that there's support for informal welfare workers, disability inclusive, and the financial independence is needed. And then develop a comprehensive social protection framework which defines a national strategy for the social protection by 2047 to ensure the coverage for the vulnerable populations, extend the formal social protection programs to informal workers, and ensure the disability inclusive policies. And then an alternative financing mechanism for the economic growth is required. And then strengthening of the public-private partnership. That will, because our private sector is also big, so that is required for the government policies to be implemented. Then in the health and digital inclusion was the technology, disaster preparedness, and the climate resilience. There should be technology-based interventions on the policies, and there is a need to encourage the youth-led climate solutions. Like, for example, the risk modeling, climate adaptation, and resilience strategies. The youth should be in the center because they can think more about that. And the digital inclusion, like, for example, the digital skills and primary and secondary educational institutions should be mandatory, or they should be promoted, and upgrading of the health facilities for the climate resilience. Next slide, please. And demographic challenges can be should be addressed by policies centered to Pakistan's large youth population, and learning from regional areas like Korea, China, and other who has the larger population. So we can use the best practices from there, and equipping the youth for the sustainable development for the which is futuristic. And green jobs and sustainable development is generate the green jobs for youth and educate from the green skills. Uh, so on the whole, future of the human capital development is we need to have innovative approaches and prepare for the future challenges. Technology and vulnerability is at the same time. There is a technology growth, like, for example, AI or the other sectors, or but at the same time we are vulnerable to many vulnerability towards the technology because we lack certain areas. And then it should be with the gender equity and the social justice. Thank you very much.
Thank you, Dr. Razia, for giving us an overview, rather the crux of your study. We are also joined by Dr. Ikhlaq Ahmed from University of Punjab. We can wait for other people. They'll keep pouring in, but by the virtue of the presence of Dr. Jasim Anwar, I'll touch upon a few strategies which are being introduced by the government. I'll try to club one or two questions and you can answer at your convenience. We'll go with two set of discussions. In the first set, I would like to ask you that what is your take on the upgradation of healthcare facilities for climate resilience? And just to dovetail, what are the current strategies of, government for population management?
All right. Thank you so much for having me, and I'm honored to speak with the future of this country. So let me first, touch upon the concept of climatic resilience and how it cross-relate with social protection. Nutrition. This not only means that we'll be providing nutrition to poor segment. This also means the food security through agriculture reforms, through making certain urban and rural areas ratio static, making certain greenlands, adopting the latest agriculture vertical farming, and so on. So that's one aspect of the nutrition and food security. The concept of health facility upgradation, when it comes to climatic resilience, is those infrastructures that are drought and flood prone, earthquake prone, or any other calamity that we might face in this global warming or climatic change. So the new infrastructures are being built which are lighter, energy efficient, carbon footprint less emission, and more towards green energy like solarization or maybe the near wave wind energy. So that's the infrastructure development that we see, and many organizations are already working, including the government and the provincial departments. So now the concept of social protection. We have a delusion in Pakistan that social protection means that only poor segment will be covered, or those that are formal shall be covered in one way. Let me explain how. I'm equally vulnerable and require social protection an accident and trauma can occur any time in your life. This means that a social protection is a holistic approach, and everything, including health and nutrition, livelihood, comes under social protection actually. How? The concept of social protection floors. It's a floor, it's a network that actually prevents someone from falling below a line of poverty in any country, which means that those who are below, government make some initiatives, provide them free health through Sehat Sahulat, or through some insurance package like UBI, Social Security, or some private insurance. And those, the government initiatives that for those people, they're targeted either by some subsidy in terms of some cash transfers, for some, subsistence allowance like Benazir Income Support Program, or some nutritional grant, or some conditional education support that brings those out of school children to the schools. So these are for those that are basically below poverty. Now, the below poverty is a spectrum, actually, a big spectrum, poor, ultra poor, and the targeting interventions. Number of studies in Pakistan, they've spoken that very lewdly, that these subsistence allowance are not very, very effective in bringing people out of poverty. So which means the bulk, the poverty line normally stays unless you have an intervention specifically designed, looking into the socio-cultural and the country dynamics and the overall economic connectivity in that area. For example, we tried in UNICEF in some areas where there was poor people, we target them, we provide them goats. Because the area was famous for goat farming, and those poor people were provided technical assistance by the department, and the goats were provided by UNICEF, and the family was monitored across the time, or 2-3 years, because you can't come out of poverty in one month. It's a generational poverty actually in Pakistan, and that worked. Bringing that concept, now we talk of the people who are above the poverty line. Do you think that the population youth bulge that we are having in this country, which by next 70 years, that will be converted into aging population, and that youth bulge will remain youth bulge if two things are constant: mortality, fertility, growth rate, and there is no disaster or major pandemic or endemic in the country. The 3-4 constants to make that bulge state. Now, because of the innovations, vaccination programs, mortality reduction programs, the growth reduction, although we are not achieving that much, this bulge is likely to move up if the growth is constant at 4 or less than 4. 4 children, I mean, not 2.3 growth rate. So when it goes up, those who are already nutritionally suffering without any social protection, I think we are all nutritionally imbalanced, including myself. I might not be taking all the vitamins required, all the healthy activities, and the same as the case with the females. So that's the generational nutritional issue that will be augmented by the climatic disasters. So the adaptive nutritional strategies are still lacking. I mean, do you think our food, which is prone to more drought, is resilient for upcoming generations? Do you think that we are able to produce the wheat, which is more iron and more other minerals within that component, where genetic engineering is capable to produce such wheats? We have not done that so far. So this goes on. Now, this comes in the contributory social protection. In Pakistan, 90% of the informal economy, or for that matter, formal economy, without government, they are not covered by any means. You're using health services, from your pocket. It's called out-of-pocket expenditure. Pakistan is highest among out-of-pocket expenditure. Pakistan is highest in catastrophic health expenditure. Any accident, any health issue, anything, including me, including you will be spending a lot of money because of lack of poor quality of services in these health facilities. So, is there any formal mechanism to protect you under social protection framework? No. There's no government-led social insurance mechanisms for those that are in private sector. That for those that is in academia, in industry, only those that are government servant, and especially those that are civil servants. Any new contractual employee is not covered by any health package. So that is a change. And once that social protection angle is covered in health, then you can apply the lens for nutrition, livelihood, unemployment, and social security covered. And then you can have a very sustainable base of youth in this country that if contributes for 3 years and then they become unemployed, at least you will be covered some part of your livelihood through that insurance that you have already purchased through government, or for that matter, through private entity. So it's a very holistic concept. Everything is interrelated, but we need to understand what is the broad of this everything. Do you think we'll be able to upgrade the health facilities very soon? No. We don't have development funds. PHDP pocket is shrinking. IMF bail package. Mission is here, 1.2 billion. Conditions are there also. Conditions to, privatize or at least, get rid of those big bleeders, state-owned enterprises, including PIA, including DISCOs, or distribution lines and networks, including steel mill. I also say our health and our education system is also a big bleeder. There are number of health facilities in primary healthcare, utility rate less than 10%. So those who should actually be coming to PHC, either VHU or RHC, and then if eligible should be referred to PIMS or tertiary care hospital, are going straight to tertiary care hospital, resulting in poor quality, overcrowding, lack of services, and then lack of trust. This dynamic then makes the entire country bog down. So this is a very long debate actually, and we have other esteemed panelists with us, and we would also like to, see what they would like to add, including you. You might be asking some questions also that might, clear your mind on how you gonna lead this country, because you are among those youth bulge. The panelists might have crossed 40, I think, already, including, Doctor, you're above 40, right?
Yes.
So I think so we would like that in more of an informal dialogue in this, so that at least we can share some experiences that we have come across in 20 years of our life, and you can take benefit of it. Thank you.
Thank you very much for sharing, sir, and the highlights. I would like to ask Dr. Saima Nazir Khan that what role does WASH do you think that it can play in strengthening human capital development, and what are the key barriers of WASH management, especially when addressing to the marginalized communities? This is the first question.
First of all, thank you so much for making me part of this very important, very, very important discussion. Madam, the step you have taken. This was in fact the need of hour, and very well described by Dr. Jasim. We cannot move one along in this sector. We need to take health, climate change, education, and all other things together to make or to just make our adolescent and youth competitive and powerful population to deal with the upcoming scenarios in the world. If I talk about the WASH, WASH, as you know, is a devolved subject. WASH is dealt in provinces. We are the central body over here, which is looking at that. But WASH plays a very important role in terms of water, sanitation, and hygiene because it is directly linked with the health. So, if we empowered our WASH sector, we will empowering basically the health sector, and which will be help in capitalizing the human capitalizing in Pakistan, especially the youth. Ministry climate change feels very much now that we should be involving the youth at all the forum, including the climate change forum at international level, national level, because their participation is very much needed and their awareness is very much needed on this subject. Because without making them aware of this scenario and this system, we cannot cop up them or we cannot make them get ready for the future challenges. So WASH is one of the area where ministry is working. We have done a lot of work. We have signed a declaration with UNICEF. Ministry has taken a notice of the Global Children Report by 2024 selected by UNICEF, in which they have indicated the three basic trends which will be affecting the population by 2050. And accordingly, we have set up our priorities. So WASH is an area where we need to work together with all education, health, ministry climate change, ministry planning, because we cannot one and only alone take out the thing within the population. It is a very sensitive area because it is directly linked with the health. And as Dr. Jasim has indicated, that if you want an empowered and a healthy, indocent and a youth that grow up, you have to focus on their health from all perspective. And for this, we have to educate them. We have to tell them what is climate change, what is WASH, what is this. And in this case, if we'll not engage them now, we cannot teach them that. We are missing climate change and WASH and such education in our education facilities, which should be the part of our curriculum and education we should take. It is missing when, like we have tried last year to engage a youth at international delegations and to participate there. And ministry is very much looking forward in the coming years to make it more space and participation of youth in it, because without taking them and interacting them with the world, you cannot say that they will be ready for the future challenges under this. Plus, WASH area I'll talk about, we are looking for climate resilient WASH, not only the WASH, because we have being the most vulnerable country, we faces a lot of challenges, floods, disasters, heats. So we need to have climate resilience WASH strategy, in which ministry is already in. We are developing rationale for our WASH sector. And we will be taking up this thing. We are in consultation with provinces, and when I myself reached there at provinces for the validation process, I learned that still there is a lot of gap for understanding of climate and climate resilient subject in provinces that needs to be built up for that. So academia is one of a core area where we can focus, and we can tap the youth there for not only the WASH, but overall the climate scenario and climate resilience area, where we need to teach them and get aware them. Without involving the youth in all this scenario, we cannot move out. We cannot process that. We have to build their capacity for upcoming challenges. So I really appreciate the work done by you and identified by you, and really supports for you. We will be looking forward. Instead, the policies should be more merging toward this scenario. This is now much needed for us in Pakistan.
Very right. I think Dr. Razia.
Yeah, just
also-
a connected question. I just wanted, you have given the overview of and the WASH as a devolved subject. Otherwise, is there any future strategy or the the youth involvement is there, but how we are going to involve the youth in the with the Ministry of Climate Change, how it is thinking like what areas they will be involving them only for the advocacy, or some really, like I have mentioned about that they can be do the modeling or something like these institutions. So how you are planning to do that? Like, because I remember the billion tree tsunami movement. At that time, there was a lot of involvement of the youth. But what is the about the sustainability of that? Is
Uh,
there any plan or any action plan or some any like which is in the policy matters or something?
Yes, we have last time signed a declaration through UNICEF where we adopted the declaration was on youth and climate change strengthening on that. We'll be working on that we will be including the youth in our adaptation policies, how we can take up them and strengthen them. We are looking for creating green jobs. We are liaising with the universities, especially the last we have created Green Tech Hub and like that, where we are empowering the youth. Plus, our coordinator office is more focused toward involving the youth in international dialogue and streaming all these things, because once they will be involved there, they will understand what the world is really thinking about the climate change scenario. And moreover, under the wash sector, we are also we have proposed in Uran, Pakistan, a big project for wash sector, which will be similar to upcoming Dreams project, and in which we will involve green jobs for the youth. And we have some voluntary programs which we like CGPI. If you have a little bit knowledge, it will be more like that. We will involve the youth in it through DCs and local district level, and their participation, because we got a very good response under Clean Green Pakistan Index, where we see that youth was too much involved and they have responded to that. So ministry is thinking to revive that. Ministry is thinking to upscale a big project for wash sector under Uran, Pakistan, where we are looking for involving the youth too much, because our 60% population is youth. So these are the areas where we are working. Furthermore, ministry policies also that we have developed a policy for engaging like 40%, as directed by Prime Minister, 40% involvement of vulnerable communities, including women and children in jobs and upcoming skills required for the in government sector.
Perfect. Ma'am, in the second set of question, I'll come again and would like to ask you regarding the disaster response strategy. But before that, I let me bring in Dr. Clark Saab. Sir, I would like to ask that what are the available safety net and social protection mechanisms at the national and provincial level currently?
Okay. Thank you very much for having me and providing me opportunity to talk to you people. Like, I may take a little discussion from Dr. Jasim. Like, when we see overall, we all are actually deprived of the social safety nets as far as the entire population is concerned. Like we have, although in the government sector we do have little safety protections, like in terms of again who are at the regular services, they might have some financial benefits, they might have some retirement benefits, they might have some insurance benefits, they might have some GP fund kind of benefits. But as the time is passing by, we are seeing and witnessing the depletion of all those safety nets. Once it was a very privileged segment, the government sector was having all those. I'm more interested to see how youth is actually looking into those safety nets and how they are feeling protected and safe when we are discussing the entire social and cultural environment of our country, despite the fact that we've been targeting the provincial protection safety nets and the federal safety nets. Like the one impression that we, because most of the time we've been spending with our youth and into the classes and taking the inspiration and taking the motivation from our youth. One thing that is becoming very obvious, the youth is feeling actually left out. This is the entire experience that we do having in our daily classroom conversations and all that. Although we as a provincial government and federal government, we do have certain plans and we are very determined to put all those efforts and making our youth a little comfortable and make them give an impression that it included in all the social safety nets. But at the ground, what we feel and what we experience on our day-to-day basis, the youth is not comfortable with all those social safety nets and all those efforts that are being made by the provincial and the federal government. Like we do have youth in our homes, like we do have the daughters and son and brother, and now if you ask someone, what's your plan, for instance, for the coming 10 years, no one will be actually wanting to stay here. Like when we are in the classrooms and we are asking our students, okay, how do you see your future and how do you see your career in Pakistan and how do you see the future of Pakistan? Most of the students, they are smiling at us and they are simply saying us, sir, we don't have a much longer plan to stay in Pakistan. It means we do have a very basic missing link that need to cater the futuristic aspirations of all those youth that we are discussing right at the right point in time, and that we are making the predictions like in 2047 and above. And these are the hopes, and these are actually the career of the futuristic image of this country, and they are actually the future. Like Jasim Saab said कि हम तो अपना काफी सारा innings जो है वो play कर चुके. So this is something that we need to look at, and we need to be more and more cognizant that how we can make this empathetic youth to the sympathetic youth. Right? This is one of the biggest challenge at the moment. Yeah. Thank you.
Dr. Jasim, once again, sir, why are majority of the funds in the health sector allocated to tertiary to the tertiary care and not preventive or curative or promotive care here in Pakistan? I mean,
So the question refers to the skewing of budget towards the tertiary. A number of reasons. I'll apply one lens of a disease, then another lens of a behavior, and another lens of the quality of care. So first, let's talk of a disease pattern. We have witnessed in Pakistan that the burden of communicable disease and non-communicable disease is disproportionately changing from more non-communicable to from less non-communicable to non-communicable. I mean, obesity, hypertension, cancer, and for that matter, all associated diseases are on the rise. So once these diseases are on the rise due to dietary issues, lack of, healthy lifestyle, or the stresses, including, lack of social protection and livelihood, because all the stresses tends to release those hormones that tends to increase the weight. And like you go for more eating, more stresses. That's one aspect. Another interrelated disease or rise issue is your mental health. It's a silent rise in the volume or the magnitude of the mental health issues in Pakistan. Stress, anxiety, almost 50% of the women are suffering with it. Age 30 to 50. Either economic stresses or stresses of the children, how they will be empowered or getting some employment, and all the things. So these are the contributors to a rising disease trend. Now, when the disease is on the rise, especially the non-communicable disease that cannot be managed in the primary health care, so the people, when they develop the complications, they have to go for a tertiary care hospital. That's one big chunk. So naturally, when the more people will come, you need more doctors, you need more medicine, you need more machines. So you have to give more budget while you restrict those, that shouldn't be coming. That's one angle. Another angle, when you look at the, say, overall diseases that are presented in any tertiary care hospital like PIMS, Polyclinic, CDA, or ABCD, anyone, there is 50% are those that shouldn't be coming to the tertiary care hospital. For example, minor throat, minor headache, blood pressure checking, just simple, sugar testing, they're still coming to tertiary care hospital, which also resulted in utilization of the services. There's a wear and tear, and there's a staffing need and cleanliness, so many things. That's why this budget is skewed. Now, that's the side of a disease. Now, the behavior. People in Pakistan, apart from their lack of healthy exercise and eating behaviors, they are also don't trust the primary healthcare services. Everyone thinks that in government primary healthcare, the quality of medicine might be bad. The doctor is the one who cannot find a job in tertiary care hospital, or the one who's actually left over, that might be sitting in that. So we will not go for that. That's a behavior issue. And behavior issue is also related to the actual trust deficit on the part of government also. Because in Punjab, I've seen some of the BHUs very well equipped and very well qualified family medicine experts and GPs in that center. So that's another trust deficit. So that's two angles that I've touched, and another one is basically the genetics of the diseases. How the food is playing on the rise of cancer in Pakistan. I think everyone in this room, you might be knowing someone in your near relative or nearby in relationship or in neighbors who's having one type of cancer. At least each one of you will be knowing one person. So this is an alarming, issue in Pakistan, which is resulting in a rise in, over expenditures. So that's basically, what we see, the imbalance of the budgetary allocations, where we should actually focus on primary healthcare. More, instead of someone with a heart attack, then we provide him stents or with, heart transplant. Why not we provide him initial blood pressure and diabetes screening in the community level at the primary healthcare level, so that instead we give more expenditure. We killed it at the beginning, while also providing allied services, good nutrition, good water, clean water. 90% of the communities are not having access to clean water. Either, by the clean does not mean the physical appearance. It's all the chemical appearances also, constitute. Some are very rich in lead, components. Some are rich in heavy metals, especially in rural areas, mountainous terrains, and many are having, contamination. That's why the diarrhea, which indirectly again contributes to the lack of nutrition in mothers and the children, and then again you're denting the youth body which is coming up by cognitive development failures. The brain is shrinking by the way of its cross-sectoral cognitive thinking. Why? Because either the child is having not good water, either having a diarrhea or poor nutrition, or the mother, while she was pregnant, was not having quality nutrition. Because mother nutrition is directly proportional to the child cognitive development. So a lot of missing links, which can be easily addressed by just one big thing, which covers everything, including climate, is social protection. Social protection mechanisms, formal, informal, government, private sector, everyone deserves to have a good quality of education and health. Education, 80,000 is a budget for per child in government sector. If I would be given the opportunity to, make a decision, I would give that money to the parent and empower him. Okay, take your child to whatever private school you want. And that money will go to that private school where you are satisfied with your children.
Dr. Sabri, just allow me to ask a relevant question that reminds me that how important is to integrate the mental health rehabilitation programs into the capital development programs of capital development.
So you see, first, while we talk of integration of the mental health into the human capital, so let us see what do you mean by human capital actually first. Human capital has a number of dimensions. One, apart from skill set, which is very relevant, and the future of the skill set, future of the healthcare, future of the tech industry, not the conventional degrees. Many are still, going for, unconventional MPH. Is there anyone who's equipped with the, robotic surgeries? Is there any degree program that we teaching nanomedicine? Or, I haven't seen actually such programs in Pakistan yet. That's the human capital building. Now, coming to the mental health side. The question is, when mental health cross-cuts with various development stages of the human beings, from mother, and then a child, it's totally neglected, corporal punishment, cognitive effect, then adolescent mental health issues, then child abuse issues, and then going to the marital life issues, and then going to your job mental health issues, job security. Is the environment conducive for male and female in terms of mental health? So I mean, it's everywhere. You name any sector, it requires mental health integration. By what? Number one, awareness. Knowing, at least first, knowing is a problem. Many of us still don't know, like either we are having anxiety or depression or any stress that we are facing. Are we satisfied with our job? Yes or no? Why? And the question is why. So make them aware. And number one is curriculum reforms, behavior reforms from the parents, community, to the primary health care, primary education, tertiary education, and then go on and on and on. So it's a holistic concept of a mental health integration into everywhere. So first step, one thing first is knowledge, knowing the problem. So raising voice, creating awareness. And then once the awareness is raised, we integrate it into climate, into social side, the protection programs, into industries, into employment sector, into academic sector, and so on. Yes.
Let me request Dr. Saima to enlighten us on the disaster response strategies in place to deal with climate-induced adversities, and what are the efforts being carried out to engage with community level in these programs.
Thank you. This is one of our core area where we are working with NDRM, National Disaster Management Authority. Ministry is responsible for developing the policies that will address the disaster, and we have a consolidated national climate change policy which particularly address the disaster policies. But the process is very complicated because Pakistan is a very diverse country ecologically. Every province is different if you look at, and every province has their own challenges, disasters, which are needed. So we have to dive down to the community level, to the provincial level, for their engagement and for their consultation for every design, for every policy designing. We have to look forward what are the challenges the community is facing, and then we have to devise the response-based policies as per their need. Because if I talk about like north of Pakistan, they have different challenges. If I go for Sindh, Balochistan, they have quite different scenarios and different. So the subject is again very diverse in term of geographically as well as population, because different population faces different challenges. If we talk about youth, children, and women, so which are more vulnerable to disaster when it approaches. Ministry has designed the policies and has make it inclusive, but it is a continuous process. It is in fact a learning process for us. Day by day, we have to learn about the challenges and what I just give you an example of 2005 when earthquake first approached in AJK. At least like 30 to 40% of the children doesn't know that this is a earthquake. They just know it's a building is shaking and it's going, but they're not aware of the disaster. So we need to prepare. If we check over this scenario in term with Japan, they're very much prepared. They prepared their children to act upon how when an earthquake approaches there for that. So awareness raising is again a very much important component. We have to teach the children and youth and community that this is a disaster, it is approaching, and how we have to cope up. Similarly, for the heat waves and droughts, we need to raise the awareness raising at a very low level. If I say we have developed a master plan at district level for integrating this thing at deep dive down, because ministry alone cannot sit in the federal level and prepare the policies for the disaster. We have to be inclusive for all. Plus, for the response measures, yes, we need to be more interconnected with health and other departments who are playing key roles in the disaster mitigation. So this is the overall scenario. But this is an area where we need to be engaged with the community, and this is a continuous process. We learn with by approaching when each of our disaster approach. This is even a lesson for us, and the things change, and we also practically learn for that. We revise the policy, we integrate it.
Thank you. Thank you, Dr. Saima. We are honored to have Dr. Mehreen Mujtaba. Thank you very much, ma'am, joining us. Before going to Dr. Mehreen, I'll go with the sequence, and I believe that Dr. Razia want to nudge me on the right path and want to ask some question from Dr. Akhlaq, please.
As we have the opportunity to listen to Dr. Akhlaq. As you have worked with the BESPA as well, and we are talking about the climate resilience. What's your take on the social protection and climate resilience? And what is the we are still on the reactive side of the social protection, and how the adaptive social protection can be integrated into the climate resilience programs. And secondly is, what about, as we are talking about the children and adolescents, what is your take on the life course social protection for the starting from the childhood towards the inclusive of the persons with disabilities and other there obviously life courses, old age, pensions, and all these things also. But from the perspective of the children, life course, is there any scope in Pakistan for this type of intervention? Or because I understand that the big advisors like the World Bank, they don't agree with that. But what is the scope of this in Pakistan?
Thank you very much, Dr. Saba. Unfortunately, many a time we've been looking while sitting at the top of the mountain, and the people trained in social sciences, we are more and more concerned with the cultural specificities. When we are calling the cultural specificities, it means every corner, every region, every culture, every state, every country is a quite unique in so many different aspects. So the social protection that the modern countries, the model they do have, we can inspire from them and we can take motivation from them. But end of the day, we need to come up with our own indigenous and localized challenge that are coming with the different social, cultural, political, and economic dimensions. We cannot outrightly ignore the local inspirations and the local incentives, like the local demands even. How can we discriminate like the people with the special needs, and how can we go beyond the dreams and the aspirations of all those who've been the custodian of this country and who are particularly the son of this soils and the daughters of this soil, to be more gender into. We cannot ignore their dreams actually. As far as our the larger models are the social protections are concerned, somewhere they are working very wonderfully, but what we do need and what we need to take into our own cultural aspirations and the local needs and demands and desires, they've been and they should be remaining at the top of the agenda of the implementers and the policymakers. But there is no actually the other discussion that how even we can think of denying the local facts and local aspirations and local demands of our own people. Like we do have the cultural ecological resistance, like Dr. Dasim pointed it out. Uh, we have like a kind of generic curriculum that is providing less spaces for the modern inspirations and the latest challenges that we have. But one thing we do need to know that is, like, when the universities will be struggling for their own survival, like we cannot deny this fact. At one instance we are making more and more universities, and at the other instances, for example, the Peshawar University, they've been struggling for the last 3 years and they are unable to pay their employees, including teacher and the researchers and the faculty members, timely. And most of the time they've been providing the half of the pay to the faculty. And how then we can consider that those faculties and those students and those researchers will be coming up something wonderful, and they will be contributing in the larger social and the development sector. So as of the part of PU, the PU is struggling 3.5 billion per annum deficit. And we do have the wonderful researcher, the wonderful scientists there. They've been, like Dr. Jasim pointed it out, we've been working on nanomedicines. Our colleagues are contributing wonderfully, but at the same time, when you do have one of the mental pressure all the time, that at the end of the month you might not be having the timely payment of your designated benefits. But I'm not looking for the exaggerated and enhanced benefits. I'm simply struggling for my designated benefits, and when you are not providing that, it will keep a constant pressure on me, and it will even make me mentally vulnerable. How I can talk about all those people who've been living in those layers, like the poor, like the ultra poor, and the poorest the poor. We've been talking about all the people who are so-called the privileged class of your country. They are facing the challenges all the time. Like they are not actually confident of, okay, after retirement they will be getting the, how they've been training the people, how they've been training the youth when they are struggling with their own internal and mental challenges and issues. Some of our departments, they've been incorporating all those, like Ms. Saima was pointing out, the climate related and ecological challenges that been coming and we as the faculty, we are upgrading our curriculum, and where we've been designing the groups and giving them the trainings and providing them the opportunity to have the internships with the provincials and the national ministries, including disaster management component of the governments. So, and we've been motivating them to take care of their depleting natural resources like the water, the carbon emission, and the more importantly, how their behavior can be in line with all those sustainable efforts. Uh, every time the universities, the faculties, they've been trying their level best to give their students a little awareness and little sensitization regarding the ecological resistance people. Like they need to come up with those suggestive behaviors that may help them, not only their own self, but as the people, as the part of their communities. And we do think these sensitized and train people, when they are getting back to their communities, getting back to their neighborhoods, and getting back to their own families, they might have a good and reasonable impact, and they can translate all those trainings and inspiration to their larger communities, and making them more resilient and more sustainable development friendly people. Thank you.
What do you think that what is the social behavior of today's students?
Yeah, this is something very,
It
very.
is a more of like an open-ended question, but
Yeah,
in your case, it's not.
yeah,
really.
this is something very interesting. Like all of us, we've been surviving the difficult situations. Uh, it may be little. I'm not talking about the particular period of the politics. The overall, the youth is becoming more empathetic. Actually, they've been not feeling the included. They've been not feeling the part of this larger system. And one thing that is actually threatening us all the time while we are working with our students, they've been drifting away from the larger mainstream that we call the nationalism. For example, they're less interested into what is happening, and they are less.
Are you talking about the LAM students?
No, I'm not talking about the LAM student. They are simply a sample of all those students. Huh? Every student, for instance, the technological deprivation. This is something very interesting. Like we haven't any idea. Like perhaps our policymakers are, to an extent, they are quite aware of the fact. But on the ground, when we are dealing the students, we are not so into that access, utilization, and technological dividend that our students right now, they've been conceiving them and they've been associating them. They are feeling themselves specialized, and one thing that they are continuously getting the impression that they are not part of this system. This is something very dangerous. They are cutting them out of this system, and how we can survive if we are not part of the larger political system or even the systems. We are the systems, and how we can survive and even think of development or some positive thing when 60% part of the system is idle and empathetic and frustrated. They don't want to stay here. They are not seeing their future here, and they are not seeing the system inclusive. They are not seeing this system just. They are not seeing this system equitable, and they've been getting more and more frustrated. But this is not a particular example of some university. It is everywhere. Like we do have kids in our home. तो हम अपने छोटे बच्चों से जब पूछ रहे होते हैं, okay, how do you see your country? और अगले 15-20 सालों में आप अपने आप को कहाँ पे होंगे, तो दे आर सिंपली सेइंग कि बाबा मैं अगले 15-20 साल में यहाँ पे नहीं होऊंगा. So it means what we are talking about right now, the adolescent and youth and the ecological resilience and the environmental resilience, it means we are lacking something. We are dragging a bag that actually don't want to go with us for the longer. But this is something quite problematic. Yeah. Exactly,
I would
exactly.
like to add in
Yeah.
this. I totally agree with this point. In fact, this was a big gap
Yeah.
which we have created in the last decades when
Yeah.
we have been not interconnected with academia.
Exactly.
We don't know what they're
Hmm.
reading and when they're practically in the field in departments. I've learned in internship that students are totally blank.
Oh, yes.
They
Very
read
right.
and what the practical is different. This is because we have been not connected. Academia, ministries, and departments
Exactly.
are not interconnected, and this is a major gap.
Yeah.
Now this gap is making a brain drain. People are moving out of the country. We have to make the strategies to stop them. Otherwise, this could be another disaster,
Yeah,
as
exactly.
pointed out.
And this is actually, we are not actually realizing this. This is the disastrous trend. And the behavior that our youth is adopting and adapting, this is catastrophic. I'm telling you, because we are one of the biggest university in Punjab. We are catering 65,000 students coming not only from the Punjab, the KP, the Balochistan, and all the component and part of the country. And most of the students, they're quite frustrated. They do not consider them the part of the plannings, part of the system, part of the programs, and they are taking themselves like they don't see them in this system for the longer run.
Very right. Well, I would now request Dr. Mehreen Mujtaba to enlighten us on the adolescents. As you know, that the adolescent is the second window to address stunting. And what do you think that is the critical investment needed?
Please.
We are honored to have joined by Dr. Abid Qayyum Suleri, who's the Executive Director of STPI. Sir, we were discussing Pakistan in 2047, the opportunities and challenging for present age adolescent youth and future of the human capital in Pakistan. And we have a very eminent panel, as you know, Dr. Akhlaq Ahmed, who has joined us from Punjab University, Ms. Saima Nazir, from Ministry of Climate Change, Dr. Mehreen Mujtaba, who has joined all those from Ministry of National Health Services, and Dr. Jasim Anwar from Ministry of Planning and Development. So I was asking Dr. Mehreen Mujtaba, as adolescent is a second window to address the stunting. What do you think that the critical investments needed in nutrition's program to ensure that young people are physically enduring and becoming Pakistan's future leaders?
Thank you very much. Actually, Ji, we have a huge youth bunch. I think I'm loud enough. I'm very loud. Okay. Youth is an economic dividend and it is human capital in Pakistan. Right now, we are at a crossroad and we are living on borrowed time because 40.2% of children below the age of 2 are stunted, 18.8% are wasted. Maternal anemia is at 50%. And these are the figures that I'm quoting from a survey which was conducted in 2018. 5 years have passed, post-COVID, post the biblical floods. We don't know where we stand currently. But wherever we are, again, I'll say we are living on borrowed time. So as you mentioned, adolescence is a time when we have to cater to their needs. But then you have 40.2% children with growing up with cognitive impairment, and they're going to translate into the youth for tomorrow. So investment in that critical stage in the first 1,000 days of the life of a child is extremely important, but then reaching out to girls and boys attending the schools, especially women of childbearing age, adolescent girls, because a majority of them suffer from anemia. So reaching out to adolescent girls in this critical time, and for that, Ministry of Health is right now making efforts to transition from iron folic acid and providing more multi-micronutrient supplements, because there is a multi-micronutrient supplement deficiency in Pakistan. Climate change is one of the major drivers for malnutrition. We are increasingly recognizing that. And hence, Ministry of Climate Change has a steering committee with Ministry of Health has a steering committee with Ministry of Climate Change to address the different impacts, especially on malnutrition in Pakistan, because we are really working hard to reduce the levels of stunting in the country and also to reduce wasting in the country. In addition to this, we plan to launch, hopefully soon, the Climate and Nutrition Initiative, which is a global initiative to look at nutrition through a lens of climate change. And again, reaching out to adolescents, certain programs that the ministry has undertaken, apart from iron folic acid supplementation and multi-micronutrient supplementation, is school meal programs. Then reaching out to different ministries, FAO, Ministry of Food Security, and interministerial dialogue to push the agenda of more bio-modified crops, so that instead of going all the way for food fortification, which will fill in the gap, and ministry is really working, is part of the National Fortification Alliance. We are trying to encourage and have a dialogue with different ministries, relevant ministries, so that we push towards more biofertilized crops, so that the unmet needs of the section of population that is not getting micronutrients in their diet can be fulfilled through food fortification, but then at the same time pushing the agenda for biofertilization as well. So I think these are some of the works we are doing, since Ministry of Health has recently moved into the arena and being recognized as one of the partners for the impacts of climate change on a number of health impacts. We are trying to pave a way and create a niche for ourselves, and trying to have a dialogue and encourage all our different ministries to consider health while they're making different policies, be it education, be it Ministry of Climate Change, food security. So
No issue. So I'll skip the question related to the climate adaptive strategies, but I'll come to what are the strategies for addressing future population crisis. And
So
then
as I already mentioned, one of the things that we are
partly address the question, but I just want to
exactly.
be more focused.
So one of the major issues that is leading to malnutrition in children and the adolescents is maternal anemia. So firstly, we are trying to address that. So women of reproductive age also includes the adolescent girls. We are trying to address the big issue of multi-micronutrient deficiencies and anemia in this age group, but then at the same time in pregnant girls and women. As you know, we belong to a country जहाँ पे बहुत सी लड़कियां adolescents ही होती हैं जब उनकी शादी हो रही हैं. So we are trying to fill in that gap. So one is that strategy which the ministry is working on. Apart from that, we are spearheading the National Fortification Alliance. So we are pushing different stakeholders and UN agencies for encouraging fortification of the staple food, which includes wheat and ghee and different consumable items. So fortification is one of the agendas. Again, we are working with with Ministry of Education for school meal programs, so that the food that is being given to the adolescents and children going to schools caters to their dietary needs according to their age groups. So these are the various interventions that Ministry of Health is working on right now. But apart from that, as far as climate change is concerned, we plan to launch the initiative on climate and nutrition Pakistan chapter, which was launched in Sharm el Sheikh during COP26 in Egypt. So inshallah, soon we'll have the Pakistan chapter for that. And that will, nutrition and human capital is going to be a part of those deliberations, and it's going to be a multi-stakeholder, multi-sectoral initiative. So hopefully we will try to address a lot of issues through these multi-sectoral and multi-stakeholder deliberations.
Very right. Thank you very much for your inputs, ma'am. I have asked a lot of questions, but now I would open the floor for your questions to be asked to these honorable panelists. Do we have questions? Yeah, sure, please.
Assalamu alaikum. I'm Mushabbir Ali from NIPS. Actually, I have a question from Dr. Akhlaq. He was talking about youth not participating or not feeling included. Could it be due to a lack of student unions? It has been banned for quite some time, and I believe could that be an issue? And I would also like to ask a question from Dr. Jasim. He talked about social protection. For a few months, I was with a Sindh Social Protection Authority as an intern, and they were working on some programs over there. But I would like to know what can be done further. Something is being done, but it does not feel enough. So those are my questions. Thank you.
Yes, the political socialization is actually the agenda that many of the sectors can contribute. The academia may be the one, the parents may be the other, the media may be still the other, the political activities happening at the campuses, yet another. Yes, we do appreciate the role that the Students' Union provided in grooming and giving such a wonderful leaders at student political arena as well as the national politics. The experience that we do have right now at universities is we do have like ethnic groups, although they've been doing the politics. I'm not saying that they're not doing the politics, but they are looking at a very tiny interest. Like they've been more into how to make their ethnic colleagues enter into some programs and how they manage to get a seat from the student advisor office and how to get different privileges for there. So yes, I do appreciate the normalization and the restoration of the student union and their activities, because everything is in the modern state, everything is connected and revolving around the politics. We need to realize and we need to appreciate all those activities that are directly and indirectly part of the politics. We cannot survive and we cannot actually move forward without the politically active and politically socialized and trained youth. We cannot even imagine of all those sustenance of the activities and progress of the systems and the country, but it's not possible actually.
Well, gentlemen, thank you so much for asking this question. I'm glad that you have worked for Sindh Social Protection Authority and how it can actually leverage the human capital in Pakistan. So it's a cross-cutting relationship, and I'll give you a few examples and a few lenses. If we apply the lens of the youth behavior, that why many, like my colleague mentioned, are willing to go out as soon as they get graduated or masters is primarily a lack of security, actually, lack of a good job security, a good quality of life, a better earning opportunity, and good education for their children. So basically, all of these lenses are somehow interconnected with the social protection and sense of nationalism. There are many countries who are very poorer than Pakistan, but yet I've seen the sense of nationalism in them, like they own their bad as well. So this is a long behavior change process, along with enabling environment and opportunities provided through institutions like social protection you have worked with. I'll give you the lens that normally social protection institutions Pakistan apply. They use the poverty lens, those who are below the poverty line through subsistence or through some targeted nutrition interventions or targeting some skill intervention. So let's say poverty 20%, 30%, it varies based on the definition that we use. By Bureau, it's slightly different. By UNICEF, inclusive definition, slightly different. And the poverty mean testing score is saying a bit different. But I'm not worried about that who are actually poor. I'm worried about those who are not poor and not contributing. Vulnerable. I'm vulnerable. Salari Sahib is vulnerable. Any accident, any life, who will take care of our families? You know, we're all vulnerable. So, and you're vulnerable. So is there any mechanism that your authority and other authorities are thinking to cater this 90, 80% vulnerable human beings or families in this country? So that's a big debate. And for that, the contributory mechanisms needs to be established. Contribution, either by civil servants, by private sector, by government or whatever, for health and education to meet our development needs and to come up with the debt cycling of IMF and others from 1950 to this recent IMF visit. And still we have this visit in this country, having $1.2 billion negotiation going on, the next tranche linked with certain structural institutional changes that we're going to take in this country. So that's one sector. Now, what has been done already in this country? Authority in Punjab, it's established, and they're creating a pension fund as well for private sector. Authority in KP is already established. In AJK and GB, it's in the process. The first ever social protection policy has been approved by the assembly in AJK, and I happen to be one of the author of that policy in AJK and Gilgit-Baltistan. And we have defined the pathways for inclusive social protection for entire population, not only for those who are poor. So out of that, endowment fund created and the pension fund for private sector has been created. Now the modalities, whether we will cover through private sector or the government, is still debate going on. Another lens I would like to add is the lens of the population growth. My colleague Ali Wasif Saab, asked from my worthy colleague here, how we will be tackling that. So I will refer back to 1994 International Conference on Population and Development, funded by UNFPA, where 13 areas were identified actually to have this population growth managed, which includes poverty, education, access to services, health, climatic change, and data-driven decisions, urbanization, migration, and also rural economies. But somehow the path was only focused on access to commodities. So the access to commodity failed somehow, that our growth is still growing at the phenomenal rate of 2.4, which is highest probably in some of the countries. Now the question is, this growth rate that's continuously rising, where is the missing link actually? Is it the link that we make commodities available, or access to commodities, or access to reproductive health, or it is empowering people to make them the right decisions by themselves actually? And that's a cross-sectoral approach, which 13 areas already identified. Now Pakistan participated, the Prime Minister and I'm lucky to write the speech for him for UN Assembly in September last year, for ICPD 30. It's a cross-sectoral approach for family, for population and development, not the planning actually anymore. It's a management and the growth and development. Out of that context, so these all actually interlinked with the support that social protection institutions can provide in this country. One last point, this is data-driven approach. You're all scientists and academics somehow, or development expert. The quantum or quantiles of a population, last 40 years, you take the data, you know, drop it down to the lowest quantile and see the fertility rate and the growth birth rate of those who are already poor, and it remains same for last 20, 30, 40 years, which means that the targeting should be for those who are already having a higher family sizes, higher fertility, uneducated, lack of access, lack of nutrition, lack of so many things. And the aspect of the life cycle approach can be adopted very well in Pakistan. Mother, pregnancy, she needs social protection, nutrition and access. Child born, first 4 years. This is how the policy of the AJK and GB has been defined. First 5 years, school nutrition program for poor and other resilient crop and food security. For adolescent, another nutrition program and social protection package. And those who are from 16 to 60 in a productive life, their inclusiveness in the economy through various social protection, health and job and livelihood security initiatives. So this is a holistic approach. Thank you.
Thank you, sir. We are really short of time. I'll get two more points. One from Shah Mureed Saab, who has joined us from Ministry of Planning. Yes, sir.
Thank you so much. Can you hear me? I hope. Thank you so much for inviting me for this very wonderful discussion with these learned colleagues and all the other participants. I'm very happy to be here. I learned a lot from all the discussion. I was actually gonna ask a question to the panelists because as it's their discussion and they're talking about very important aspects of adolescent health through the life course and very important. So my question is more related to the laws and legislations that are available currently that the Pakistan National Assembly or at the provincial level that are acted and are present. Do you think they're sufficient or do they need to be changed or upgraded given the changing environment of adolescent health or social protection? Because I think what I have observed that there's a huge lack of laws whenever, because if there are no laws you cannot hold anyone accountable for what they are doing, and without laws you cannot institutionalize adolescent health or adolescent issues at any level. So this is one aspect that I wanted for any of our panelists if they can comment on this. So that's it. Thank you so much.
Perfect. Thank you, Mureed Saab. Dr. Akhlaq, I have received one question from our online forum, and one of our attendees, Dr. Nosheen Nasir, who is a lecturer at Government GPP Department of NDU. She wanted to ask that, as you mentioned, that there is a lack of trust. You talked of brain drain. How we can make it brain gain? So, what are your?
It's very difficult. We cannot do it overnight because we need to see all those things that manage to contribute to this catastrophic situation. And perhaps when we are going for the remedies of all that, we need a more aggressive, multi-sectoral and more passionate approach to bring all those damages back to the normal. I hope and I pray, I'm quite optimistic that many of the sectors, including the academia, the media, the civil society, and they've been contributing at their from their own front and from their own capacity to minimize those damages. And if we are being able to develop some consensus and being agreed upon on some mutual points where despite the political affiliations and despite our own agenda and something, I guess then we can make this brain drain to brain gain. We need to restore the confidence of our youth that this is your country, you are the custodian, and you are the prime beneficiary of the whole system. And whatever is happening, once we are able to give them this confidence that this systems belongs to you, you are the system, and you are the ultimately beneficiary of the systems. Now it's up to you how you are trying and how you are planning to have this space for you. I think if they've been giving this confidence, and it is again depending upon all those we most of the component of sitting here right under one roof, and if we manage to give them a confidence, I hope and I pray that things can be in a right and wonderful direction.
Right.
From various angles, if you're talking of social protection angle, actually. So the legislative environment is lacking in terms of having a strategic framework that how various institutions, public and private sector, collaborate together for making a social protection floors in this country, preventing those falling below the poverty line, the vulnerables, all of us. And some legislative cover is there for the poor segment in shape of either some authorities were working or, poverty division that was, combined by BISP and Zakat, Baitul Mal, and, there's another poverty initiative, I think Poverty Alleviation Fund. The three merged to make a ministry, and they have some legislative cover. But you're right, there needs to be a holistic legislation made in consultation with the provinces to have a framework of social protection in this country, and how each one can contribute and can be protected from all the risk of life, whatever the stage of life they are. Mothers, pregnancy risk, bad delivery, nutrition, child, cognitive, corporal punishment, good education. Then you're going to adolescent, the right skill set for the future of our generation, the human capital, how we will build this, the future of job security in this country, then having employment security through various disability inclusive, gender inclusive, formal and informal sector inclusive social protection, employment protection, and then pension cover for all of us, not only for civil servants, for all private sector, that they should have the good pension cover. That legislation and framework is very much needed, and this is the right time that we should all work together. Thank you.
Thank you, sir. Yes. Yeah.
Your ideas are really great, and listen to it, and it's a reason that needs to happen in Pakistan. But given the fiscal condition in country and the IMF condition, do you think we'll be able to make space for this?
Yes, exactly. So this is my favorite topic of financial space. So I'm more than happy to talk. Yes. You know how much PIMS budget is from the current side is 10 billion. And polyclinic is 6 billion, 16 billion. Current state budget 50. Would you like to go for any delivery or any heart attack to these two hospitals? I'm not sure. No, right? No. And for covering entire population, for universal health protection, for AJK, GB, and ICT, we need only 7 billion, 100% cover to what hospital you want, including Shifa. So this is a mismanagement of finances. It's not the lack of finances. So the way we manage our finances is the actual key to is this economic war and the trade war that the global Trump 2.0 agenda is also embarking on, and we are part of that through either IMF or ADB or World Bank financing, or that extended financing facility that we are availing. So this needs to be done, that we need to come up with the efficiency of our financial spending on the way it should have been done for the maximum gain. So there's no issue of funds, rest assured. Certainly how we use it.
I'm cursing that I was the only barrier between these good questions and this debate, but unfortunately I have to manage the time. And with this, I would now request Dr. Abid Qayyum Suleri, who is the Executive Director of Sustainable Development Policy Institute, for his closing remarks, please.
Well, thank you, Wasif and Dr. Razia, for organizing such an important discussion, and thank you, very respected panelists, for joining us and contributing in our knowledge. I got educated, and especially your last argument, the PIMS and polyclinic vis-a-vis the universal insurance. That's really very thought-provoking. And ladies and gentlemen, the topic we are talking about is 2047, and let's assume how Pakistan would be in next 20-22 years. It would be, the world would be, of course, affected by climate change, and Dr. Mehreen Mujtaba had been talking about it. Most of the reports, they keep on stressing that the world would be facing a challenge of antibiotic resistance in next couple of decades, and especially the developing countries where antibiotics are being used indiscriminately and are available off the counter. So now the challenge, as the reports are predicting, will not be a virus or a bacteria. It would be that many of us we will develop this resistance to the antibiotic that we are using, our pathogens, and that would be a major challenge. We are also talking of an era where, according to World Economic Forum and McKinsey and many others, that almost 40% of the functions that we are doing today, much earlier, 2047 is a bit far, by 2030, we are saying that 40% of the functions we are doing today would be automated, which means that we will have to adapt our skill set. The future of the job report of World Economic Forum, it tells us that almost 20% of our degrees and disciplines, those would be relevant in next 10 to 15 years time. For example, they're saying that there would be no need for radiologists. Our machines, they will be telling us, and most of the lab tests that we take, so the machines, they would automatically diagnosing it, so we will not have to go to a radiologist or to a pathologist to find out what's wrong with us. So this is the type of era where we are talking of developing human capital and finding opportunities for our youth. And on top of it, yes, the world would be getting more xenophobic. So the type of far-right governments that are getting elected, and German elections were on Sunday, was just one of the manifestation of it, where the German Alternative for German party, it got one of the highest vote, doubled in over 4 years. So this is the type of era where we are talking of our youth. But the opportunity I see is adapting our education system to artificial intelligence, to large data module. The youth today is more empowered, is more confident, and has more opportunities because they have the whole world under their fingertips. So it is about knowledge management. It's about accessing the right opportunities. So this is something that we never had. I remember that in the today's adolescent and youth age, I had to find someone who could take me to the British Council Library or American Central Library so that I could get access to something, because there was simply no other way to access to that knowledge. You are more empowered today. You have more access to information. You have more access to knowledge, and you can make your voice heard. And I think that is an opportunity. On sitting on policy side, and as I also take part of the blame because I keep on serving on many policy making forums, I think whether we do something for our youngster or we don't do anything for them, they will evolve their own path. Now, that is a different matter, whether that path would be a transformative path or it would be a destructive path. But we simply can't stop youth empowerment. We can't stop access to knowledge and access to information to youth, and we can't stop them from raising their voices, and they can make their voices heard. Now, I think our job should be to facilitate them so that they can be productive citizen, and they can be more useful human resources for the jobs of the future, for the knowledge of the future. And if that can be done, of course, Pakistan in 2047 and youth in 2047 would be far better off. I'm sure they would be better off than today, irrespective of the fact if we do anything or not. But they will be much better off if they are supported by some policy intervention, some financial allocations. And I think that's where the path forward is. I again thank you to the panelists and to the STPI team, and one looks forward to the recommendations that would be compiled. I think this is the appropriate week and month where many of your recommendations can be forwarded to Ministry of Finance while the budget making process is in full swing. And if we have any tangible recommendation for financial allocation, that should be forwarded to Finance Ministry so that it can be considered for the next budget. Thank you very much once again for joining us. Photo, I think. Yeah.